Surgery has had an astounding transformation from its roots in Mesopotamia all the way to its astonishing procedures that would have now been unthinkable previously. The advancement of surgical techniques and the development of the things required to create these advances in surgery have led to the expansion of the human lifespan itself. This has not only allowed the human race to live longer, but has allowed it to become more prosperous, as the longer living humans now knew more about their body than ever. This is the story of surgery and its progression through the ages.
As surgery first began to take place, its many intricate processes were crude in how they were performed. In addition, the poor sanitation during this time period led to the failure of surgical procedures. Most of the world during this time lives with an unhealthy amount of filth, little to no water, cleanliness, and hardly any sanitation. This ultimately led to horrid hospital conditions and common failing of surgical procedures. For example, in many cases, the patient would die of gangrene from the conditions within the hospital due to the filth and the incorrectly treated wounds from the surgical incisions. Other than the absurd conditions of hospitals in which these doctors operated in, the doctors themselves had an odd variety of instruments through which they performed these procedures. These include amputation saws and knives, cranial drills, various forms of forceps, and more. These tools were used in a multitude of procedures that often left the patient mutilated or otherwise injured.
Another crude aspect of the surgery in the Middle Ages was anesthesia. Earliest forms of anesthesia included various substances that are not generally considered when thinking of anesthesia. Some of these include the utilization of various narcotics, such as cannabis, ether, henbane, opium, wine, and mandrake. These substances were mixed and matched depending on the various surgeon to create a sedative that was potent enough to last throughout various painful procedures. These mixtures were induced through various methods such as inhalation through substance-soaked sponges and oral concoctions. The research of such relief of pain was difficult in Europe's Middle Ages, as a popular theological doctrine advocated for pain as it supposedly served God's purpose. Despite this, many local practitioners had varying degrees of success. The early procedures of surgery often involved the swiftness and accuracy of the surgeon, especially in amputations, in order to limit the amount of pain. However, the lack of effective anesthesia prevented the surgeon from going deeper into the human body, limiting them to external tumors, amputation, and trephining before the patient would react to pain.
Surgery overall did not seem to have a very promising future, based on its high mortality rate and absurd procedures that are more of a detriment to the patients rather than a solution to their problems. But there was success. Stories of miracles and the completion of complex neurosurgeries whispered here and there. The climb towards a more advanced medical society was no simple feat, as the research required for these advances was condemned in various areas. The physicians that were able to create these new techniques were hailed as pioneers. The turning point in the surgery marked a turning point in medical history, as man's life was even further prolonged through the development of all these new surgical procedures. Sanitation was of utmost importance as surgery was being revolutionized. There were procedures put in place to ensure the cleanliness of the doctors, the patients treated, and the tools used during the surgery. The doctors were required to meticulously wash their hands for a certain amount of time to minimize the spread of bacteria. patients were also treated with a cleansing solution near the area of incision to avoid any chance of infection entering the wound. There were also new sterilization techniques for cleaning the surgical instruments. Other than the manual cleaning of rooms, new techniques were developed such as the utilization of UV light, which allowed for the removal of 90% of all bacteria within a room.
As surgical techniques became increasingly complex, doctors needed to regulate the efficiency of procedures. One way they did this was by setting a standard for the tools used in surgery. Medical instruments were mass-produced in stronger, non-chemical reacting metals such as titanium, chromium, and vanadium. These tools were also now included in the education and practice of surgery, which helped regulate the precision and teaching of these techniques. Along with these newly useful tools came standards of sterilization. The utilization of heat rather than merely chemical sterilization ensured that all bacteria were killed before the next procedure. Various machines were created for the diagnostics of the patient as well. These machines use X-ray technology originally developed in 1895. This led to the creation of the CT scan, which utilizes computerized axial tomography to stitch images together. These diagnostics allowed for the surgeons to specifically locate the issue prior to the surgery, thus allowing for better preparation before the procedure.
Following Joseph Lister's discovery of ether's pain-relieving properties, anesthesia saw major developments. The new forms of anesthetics were normally administered intravenously or inhaled. Under general anesthesia, the patients were unable to feel pain and may have also had memory loss of the procedure or short-term amnesia. Surgery now required a specific doctor who would monitor a patient's vital signs and rate of breathing during the procedure or an anesthesiologist. People realized by numbing the patient, surgeons were able to perform much more complex operations without fear of badly injuring the patient. Since surgeons had less fear of making mistakes mid-surgery, this ultimately led to major developments in operations. So, can you tell me a little bit about the importance of anesthesia in modern surgery?
Yeah, sure. So anesthesia serves the purpose of either knocking the patient out or keeping the patient numb while the surgeons do their operation. Without the usage, then the patient would feel excruciating pain and possibly die from the surgery. Modern anesthesiologists actually have a really important job in keeping the patient alive, because if the sedative is not strong enough, then the patient could possibly wake up during the middle operation, and if the sedative is too strong, then the patient could possibly go into coma.
Procedures in the 20th century and the era moving forward began to utilize newly created technologies in the medical world as well. For instance, the development of cardiopulmonary bypass technology allowed open heart procedures to be carried out, as the machines acted as a pseudo-heart. Other such complex operations were now commonly completed, including neurosurgery and organ replacements, utilizing the power of diagnostic machines and robotics such as the Da Vinci system, where surgeons would place a 3-legged robot inside the patient with the 4th leg as the camera, allowing the surgeon to make small, precise incisions that would be impossible by hand. The incorporation of such technology was unforeseen just decades before its introduction into the operating room.
So, what advances led to more efficient procedures in surgery?
Well, there were many breakthroughs in the different aspects of surgery. For example, local practitioners found useful methods through trial and error such as potent and non-lethal forms of anesthesia. There was also the creation of many tools that were more relevant to the newly created procedures rather than any sharp scrap metal that happened to be lying around. During the end of this age, many surgeons also focused on sterilization techniques to prevent sanitation-caused illnesses as well. Surgery has really gone through many changes through the many eras.
As we have seen, surgery has changed much through its progression through the centuries. Not only did surgery allow the medical world to learn more about human anatomy and physiology, but it also extended the lives of a great many. This allowed humans to achieve heights never reached before. Anomalies such as conjoined twins and cardiovascular procedures were increasingly solved as techniques such as radiology and robotics entered the operating room. Altogether, humanity was furthered due to these many advances in surgery. As we continue to become more adept at these techniques, we can only notice benefits from surgery's development even in this century. Many epidemics and currently incurable diseases will become a thing of the past as the medical world pulls humanity nearer and nearer to an ideal world, a utopia free of disease.